head is pretty. Feels like I'm gonna die.
How long have you had your headache?
I just started like right now. I
Oh
don't
my
know what's
God.
going on.
Are you feel nauseated?
I'm very nauseated. It's
Mm.
really, it's really bright out here.
Okay, did you drive?
I drove.
Okay, well, I'm gonna call 911, okay?
Yeah. Please get me some help.
Okay.
How common is a brain aneurysm? In the U.S., there is an estimated 6 million people who have an unruptured brain aneurysm, or 1 in 50 people, according to the bofound.org. What is a brain aneurysm? A brain aneurysm is a bulging, weak area in the wall of a vessel that supplies blood to the brain, called an artery. Sometimes injuries, birth defects, or diseases like high blood pressure can cause a weak spot in the wall of an artery. Over time, the pressure of blood flowing through the artery stresses the weak spot further. The constant pressure can cause a balloon to bulge out, called a cerebral aneurysm. As an aneurysm grows, it puts pressure on nearby structure, causing double vision behind the eyes and headaches. As the bulge grows, it becomes thinner and weaker. It can become so thin that the blood pressure within it can cause it to burst or leak, damaging surrounding brain structures, causing severe brain injury. Signs and symptoms. Well, sudden headache is the main feature that distinguishes a bursted aneurysm from a common stroke by a blood clot. Usually within seconds of brain aneurysm bursting, there is a headache that is so severe you can't even imagine. This can also be followed by vision problems, nausea and vomiting, neck pain, and confusion. Large brain aneurysms that not yet bursted may cause double vision, pain above and behind the eye, and mild headaches, while small aneurysms can go undetected and be discovered by chance during a scan for some other problem. 2 risk factors raise the risk of an aneurysm: smoking and hypertension. Age is another factor. Older people are more likely to have an aneurysm than younger people. Smoking is dangerous for anyone who has an intact aneurysm, since it raises the risk of bursting. Treatment options include observation, clipping, or coiling. In observation, sometimes the best treatment may be to simply watch and reduce your risk of rupture by quitting smoking and controlling high blood pressure. Aneurysms that are small, unruptured, and causing no further problems may be observed with imaging scans every year until surgery is required. The most common treatment for an aneurysm is direct surgical clipping. Using general anesthesia, an opening is made in the skull to locate the artery with the aneurysm, where a small clip is placed across the neck of the aneurysm to block the normal blood flow from entering the aneurysm. The clip is made of titanium and remains on the artery permanently. In contrast to surgery, another form of treatment is endovascular coiling. In this procedure, a small plastic tube called a catheter is inserted in the artery in the groin and then passed through the blood vessels to the aneurysm using a live X-ray view. Through the catheter, the aneurysm is packed with material, either platinum coils or balloons, allowing a blood clot to form, preventing blood from leaking out of the artery. Emergency treatment of a rupture aneurysm includes starting the drug nimodipine as soon as possible to reduce the risk of losing blood supply to that part of the brain. Nimodipine works by relaxing blood vessels in the brain to allow the blood to flow to damaged areas. Now, when you recover aneurysm, patients may suffer short-term and or long-term deficits as a result of a treatment or rupture. Some of these deficits may disappear over time with healing and therapy. Unruptured aneurysm patients recover from surgery and endovascular treatment much faster than those who suffer a ruptured aneurysm. The probability of having a second bleed is 35% within the first 14 days after the first bleed. This is why proper surgical treatment is performed as soon as the aneurysm has ruptured, so the risk of a rebleed is lessened.